You're looking for ways to get cash pay patients out of pain just a little faster. Before you take more CEU courses, before you get a manual therapy fellowship, an OCS, more credentials, I'm here to share an easier way to do it with cash pay patients specifically. My name is Garcia. I help cash-based physical therapists thrive in business and improve their clinical outcomes so they can enjoy the craft that they've always wanted to. When we look at cash pay patients, there's a reason why they continue getting in pain. There's a reason why nothing else has worked. They've been to the orthopedic, traditional mill-like setting. Maybe that's where you came from or you were raised in this profession. And ultimately, they're looking for something a little different. And when they're looking for manual therapy, they're looking for exercise, they're doing all these things. You have to figure out what is it that they really need to get out of this pain. And the traditional model is to look at the impairments, right? So how do I look at their hip adduction with femoral internal rotation? And that's the real reason. But you have to understand that probably came from the insurance-based physical therapists who just saw them a week ago. And now they're in your office and you're trying to figure out, how do I get them out of pain just a little bit faster? Here's a framework that has helped me grow to 3 locations and over 15 staff in a cash pay setting. When you look at a cash pay patient, you have to figure out what are their aggravators and what are the things that are helping them recover? The aggravators, typically in a orthopedic model, we think of impairments, right? So if you have additional stress being applied from a adduction internal rotation moment, you have that internal knee pain. Now, that has worked and that's fine, but we know that impairments over time are due to repeated stress. So instead of just looking at the impairment that they have tight hips, weak hamstrings, whatever it is that you're good at your craft with, look at their overall aggravators. Meaning, what do they do for the 23 hours that they're not on your schedule? What are they doing for 8 hours of work? Are they sitting? Are they standing? Look at the total stressors. Do they work a construction job? Are they standing all day? Are they going up and down stairs? Those are the total aggravators at work. That's one setting. Then what do they do on their ADLs when they're at home? How do they sleep? How do they sit? What's their couch like? What are the aggravators in their home environment? Are they apparent? Do they pick up their kids poorly with bad mechanics? Are they reaching into a car, with poor mechanics? And then lastly, now that you have their ADLs and their work environment settled, what do they do from a fitness standpoint? Do they run 30 miles a week? Do they go to the gym 3 days a week? Do they go to the gym 7 days a week? Are they doing too much cardio? Are they doing too much weight? Do you need to adjust a few things in their strength and conditioning program? Those are the aggravators outside of the traditional impairments. And the traditional impairments are fantastic. That is how physical therapists have thought about for decades and generations at this point. So what can you do outside of the norm to help these people get out of pain faster? Now, your manual therapy, your techniques inside that 1 hour are going to get them pain-free instantly. I get that. But now, what do you do to make that last? Instead of just applying the tape and saying, hey, I'll see you in a week, what can that patient be doing for the week that they're not with you? What is it that they're missing in their program besides the tape and the manual therapy? How can we hold those new positions and that tissue quality and everything else without adding more stress? So then you have to get to know what their outside stressors are. So you have to know their frequency, their intensity, and the time and type of fitness that they do, ADLs, and work environment. All of those things will help you put together this beautiful framework to help this person understand, oh, I see, you were training too hard, an hour and a half in the gym, you were sitting for a living doing nothing, and then your ADLs, you had bad mechanics. On top of that, you had poor mechanics. That creates this well-rounded approach that every patient can understand. And you have to simplify that with, here are the 2 or 3 things that I want you to do at work, at home, and in your fitness. That will help long-lasting results from everything you did inside the clinic. That's fantastic. You help reduce the aggravators. The second part of this is you have to understand what the recovery process looks like. Okay, so these are the things that we're adding stress. What are the things that are refueling them? And that is a recovery process. So what's their sleep quality look like? What does their nutrition look like? And then what does their hydration look like? Are they refueling after they get themselves into stress? We forget that exercise is a stressor. It's breaking down muscle tissue. It's putting stress, good stress, onto the tissue so it can rebuild. But what are they doing to help rebuild that stress or that tissue in that remodeling phase? So physical therapists typically think of impairment based, right? So these are the stressors. That's fantastic. But if you don't look at the total picture of their aggravators, you're only getting a small glimpse and you will have short lasting results. And that's okay in an orthopedic insurance style model, not in a cash pay model. Then you're going to add in, what does the recovery process look like? You have to get detailed information about their diet, their hydration, and all of their refueling, plus the recovery and what their sleeps looks like. Now, when you put in, you've controlled their aggravators and you've maximized their recovery process, you have this remodeling process that is unstoppable. And it allows you to maximize that pain-free, long-lasting result that you did in the session, and now you're trying to maintain out of the session. And that is what's going to help you inside a cash pay practice with cash pay patients specifically. So if you're looking to maximize results and get patients pain-free quickly and have it last for 1, 2, 4 weeks, this is the model you need to introduce. I hope this helps you inside your clinical practice.